Thank you for joining us for this community conversation on chemical dependency and recovery. I'm WRFA Public Affairs Director Julia Ciesla-Hanley. The opioid crisis in Chautauqua County goes beyond our geographic boundaries to all of the United States. According to State Comptroller Tom DiNapoli, drug overdose fatalities surged during the COVID-19 pandemic in New York State, with opioid-related deaths increasing by 68% to nearly 5,000 individuals from 2019 to 2021. Overdose deaths statewide from opioids and all drugs totaled 5,841 in 2021, surpassing the previous 2017 peak by more than 1,700 fatalities. The New York State Attorney General's office joined other states in successfully suing pharmaceutical companies who distributed opioid-based medications. And we've also seen over the decades changes in how treatment of substance use issues have been handled. We've brought together a panel of people to discuss all of these topics tonight. But first, I would like to thank those of you listening to the program on our airways on 107.9 FM, as well as those watching online. While we don't have an in-person audience at this event, those watching online are invited to submit questions for our panel using the comments section. If time allows, I will then ask those questions. We do ask that you keep your comments brief. Also, this program is being made possible through funding by the Corporation for Public Broadcasting's American Rescue Plan Act Stabilization Grant Fund. So I'll start now with introducing you to our panel of guests tonight. I'll start to my very far right with Dr. Scott Cunningham, who is the Medical Director for Chautauqua County Department of Mental Hygiene. Next to him is Emma Fabian, who is the Associate Vice President of Harm Reduction with Evergreen Health Services. And then to my immediate right, we have Steve Kilburn, who is the Grants Project Director for Chautauqua County Department of Mental Hygiene. So welcome everyone here tonight.
Thank you.
So we'll start with Dr. Cunningham for our first question. And the first question that I'll be asking the whole panel is, how do you define addiction and how do you define recovery?
Yeah, that's a great question. I think there is depending upon who you ask, I think there's a lot of different various definitions, right, and thoughts and maybe stigma behind the addiction. I know we're going to talk about stigma later. So it depends which resource you look at. I like to go with ASAM, the American Society of Addiction Medicine, and I printed out a couple things about how they define addiction. I'm just going to, if I can read this briefly. Addiction is a primary chronic disease of brain reward, motivation, memory, and related circuitry. Dysfunction in these circuits leads to characteristic biological, physiological, social, and spiritual manifestations. This is reflected in an individual pathologically pursuing reward and or relieved by substance use and or behaviors. We can further characterize addiction as the inability to consistently abstain, impairment in behavioral control, craving, diminished recognition of significant problems with one's behaviors and interpersonal relationships, and a dysfunctional emotional response. Like other chronic diseases, addiction often involves cycles of relapses and remission. Without treatment or engagement in recovery activities, addiction is progressive and can result in disability or premature death. So that is the long-winded definition of addiction.
But I would say a very official one. So
it's official, and again, if you look at other sources, they all hit on the chronic and the relapsing aspect of addiction and impaired functioning, pretty much across the board.
Emma, same question. So do you define addiction or recovery any differently?
I don't know about differently. I like the ASAM definition that Dr. C just shared. I think it's very comprehensive. And I think it's just talking about what addiction is a great way for us to start this conversation. As someone whose background is being a trained social worker, and someone who occasionally gets the opportunity to teach for future social workers going into the substance use field, I also would add that we in the field use a manual, we use resources, and we assess what's going on in someone's life and pick out some criteria, match the behaviors, the dependence, what's going on in somebody's life with criteria, most notably in the Diagnostic and Statistical Manual, the DSM-5. And so what I think, for me, I think about the DSM-5 criteria when I think about substance use disorder, with alcohol use disorder and opioid use disorder, which is certainly ravaging our county here in Chautauqua County. The physical dependence component to addiction is really prominent with opioid dependence and alcohol dependence. But overall, I would say in lay terms, addiction for me, what I see every day in the field, is individuals continuing to engage in a risky behavior despite the negative consequences. And on the flip side, I think that recovery for folks looks different for each person, but I would say that recovery is individuals beginning to get some control over the negative consequences, whether that is completely abstaining from substance use, therefore the negative consequences are not in their life anymore, or whether that's just getting managing their use or using safer, and thus minimizing those negative consequences.
Moving to Steve Kilburn. Steve, how would you define addiction and recovery?
Well, certainly, echoing what both Emma and Dr. C have said, it probably represents the fact that addiction, it's sort of like, you feel like you know it when you see it, but then it's not easy to always describe in its entirety. There is kind of a rule, not a rule of thumb, but maybe just a kind of shorthand version that captures, I think, much of what they've both said. Around 4 C's, and those C's have been mentioned, actually. Let's see if I can remember them all right now. Cravings, compulsion, consequences, and control, or in the case of addiction, the inability to control. So where those are present, the compulsion to use, the negative consequences, as have been pointed out, it's addiction by definition is a pattern of use that has continues in spite of negative consequences. The cravings to use, the inability to control it. And while those are sort of the 4 C's that are sometimes used as a shorthand, I might add, because I think it's important to add a 5th C, you could probably add many, but change, and that is changes in the brain. The person with a chemical dependency isn't, I guess maybe 1 C that we might add but wouldn't want to major on is choice. It's more than a choice. There are changes that have taken place in the brain. So the compulsion, the cravings, etc., are a very powerful experience for somebody with an addiction. And then, so with recovery, I think much like Emma said, I would say that while sort of addiction is to whatever degree those C's are present, recovery is the process of moving away from those realities. Maybe it's early in recovery, and so those have just begun. Maybe it's well into recovery, and there's a large movement away from those things. But I think any movement away from those C's is recovery.
Mm-hmm. Steve, I'm going to stay with you and ask, what are you seeing with substance use in Chautauqua County?
Well, almost certainly we're seeing more of it, but I want to be careful to keep within what we know to be the case. Measuring the prevalence of chemical dependency, of addiction, or just substance use. And by the way, it is, I think, also important to acknowledge that the issues surrounding the use of chemicals don't all fall within the definition of addiction. People die of say, fentanyl overdose or poisoning, we might say, who don't have an addiction. So chemical use is on a continuum, not all of which meets the criteria for addiction. Whether or not there's more chemical dependency, I'll defer to Emma and Dr. C's opinions there. I can definitively tell you that much like the facts that you quoted, Julia, at the beginning, we have seen a tragic increase in the overdose deaths here in the county, and that had been trending upwards, but 2021 in particular, and sadly by evidence thus far this year, again, we're seeing really the worst years that we've ever seen in that.
Right. And Moving on, Emma, I'm going to actually move to you first, ask you, since you may have a better sense too for what is happening with substance use in Chautauqua County. And I had been talking with our police chief here in Jamestown on Monday night because there had been a drug bust involving 181 grams of fentanyl. And I said, how much of that is fatal? And he says, very, very small amount. He says, you'd be very surprised. And I think he provided me a chart. And the chart implied that it was like 1,000 micrograms, which would be, I guess, equal to 1 gram. It would be considered definitely fatal. And I don't know if that's what the experience is, what you've seen in the field. But yeah, I mean, just what are you seeing other than fentanyl or in general, other with substance abuse here in Chautauqua County?
I think you're right to point out that fentanyl is really the driver of a lot of the extreme substance use and severe substance use disorder that we're seeing in Chautauqua County. I think like all of New York State, overdose rates are rising in Chautauqua County. I think it's worth noting across the United States and across New York State and across our county here, anxiety and depression, mental health and substance use, really those conditions have been extremely exacerbated by the COVID-19 pandemic of the past couple of years. So our whole state is seeing rises in those mental health symptoms as well as fatal overdose, unfortunately. A combination of this synthetic opioid known as fentanyl becoming prevalent in our opioid supply and now actually showing up in supplies of other substances too, stimulants like cocaine, stimulants like methamphetamine. That is why probably the chief reason why we're here this evening talking about this crisis. I will say, I don't know whether chemical dependence is more prevalent than it ever was before, because I think people have always used drugs. People are probably always going to use some form of drug, but fentanyl is causing the chemical dependency to be more severe than I think probably ever before. And methamphetamine is quite prevalent here in Chautauqua County. Yes. And so I think a couple of the things that make Chautauqua County unique as compared to the rest of the state are that prevalence of methamphetamine. Unfortunately, some of the methamphetamine is now deadly because there's fentanyl in it. But also I think rural areas such as Chautauqua County, or areas that are a little bit more rural, the stigma associated with living with a disorder, mental health or substance use, is increased or at least different in rural communities. And there's less access, or at least less variety, access to a less variety of different types of treatment than might be available in other settings. So just, the fatal overdoses are on the rise, but I think there's a number of reasons for that, and COVID-19 has played a big role in it.
Definitely. Dr. Cunningham, what's your experience in seeing what is happening with substance use in Chautauqua County?
So I'm actively working in the field of addiction medicine for Chautauqua County currently. So as Emma and I were talking before the broadcast, I am seeing patients routinely basis. I have a full caseload, and daily, routinely, we'll go over someone's urine tox screen, and there is fentanyl in there, and to their surprise, they had no idea that fentanyl was in whatever drug they were using, thought they were buying, thought they were getting from someone. So again, to reiterate what Emma was saying, I pretty much tell my clients that you can pretty much count on fentanyl being in everything. Yeah. With that in mind, we try and pass out, we have fentanyl test strips that they can test their drug to see if there is indeed fentanyl in there. Those aren't 100% accurate by any means, so we don't want to cause a false sense of security, thinking, oh, there's no fentanyl in my drug. I'll let Emma talk more about what we call safe use or safer use or harm reduction practices, but the two biggest things I see on a daily basis, number one is how did fentanyl get in my system? So we trace back, we process, and the other thing again is the prevalence in our community today of methamphetamine. Yeah. It is just, they call it the devil's drug for a reason. It is just destroying lives. It's really just a really, really bad drug and can take people down a very, very dark path in a very short amount of time. Those are the two biggest things I see.
Could I echo something Dr. Cunningham said? First, that fentanyl is virtually ubiquitous in the drug supply. Not 100%, but one of the messages that we do try to get into the community is the assumption should be that whether you're using what you think may be heroin or methamphetamine or cocaine, the assumption should be there's probably fentanyl in it. That's how prevalent it has become. And further to that point, as Dr. Cunningham was relating, with patients who don't even realize that they would have gotten fentanyl, at least from the standpoint of toxicologies that we see of deaths, and I don't know, Dr. Cunningham, if you see something otherwise in your patients, but heroin itself, heroin proper, has virtually disappeared.
Yeah, I am actually, if I see someone test for heroin and the breakdown metabolites of heroin, I'm actually surprised.
Yes, it's very, very rare now.
Patients will tell me, I bought heroin, I'm using heroin. And we have the instant drug tests we use, the instant urine toxicology test we use, and we have a fentanyl dip strip, and I will show them. I said, well, there's no heroin in your system, but there is fentanyl in your system, and their eyes, their eyes light up, because everybody knows what fentanyl is synonymous with. Fentanyl is synonymous with risk of overdose and death.
Yes.
I mean, I am. When I first started here 5 years ago, it was all heroin. Yeah. Very rarely did you see fentanyl on the scene. But now it is entirely shifted. That's why you're seeing these narcotic busts with so much fentanyl. They kill thousands of people. So just I'm not trying to keep reiterating the same point here, but I'm actually surprised if somebody does test positive for heroin.
Mm-hmm. And that's pretty shocking, I mean, to hear, because I think this is the first time I've heard that it's really that prevalent. We've heard it's prevalent, but didn't realize it was so prevalent that it's just like out.
And again, people, the people who are the dealers or the sellers or the pushers, whatever term you want to use, they're telling the buyer, hey, this is heroin. It's not. So again, to reiterate, what you think you're getting and what you're actually getting. Two completely different substances.
Yeah.
Emma mentioned earlier, rightly, that fentanyl is synthetic.
Yes.
And that's in contrast to heroin, which is based on the poppy plant. Mm-hmm. And then Emma also mentioned about methamphetamine. So these are the two, in some ways, the most damaging drugs. To be completely accurate, alcohol and nicotine remain the deadliest addictions. But to be sure, the crisis is driven by fentanyl and methamphetamine today. But the point I just wanted to pause and make is that these are both synthetic. They are neither of them dependent on agricultural products. And that's significant because that complicates the supply chain. When a poppy plant or a cocoa plant, cocaine, is involved. So now these chemicals are being produced in quantities that are just staggering. They're built, or they're made out of legitimate industrial chemicals. So those chemicals can be purchased on the market, and then with pretty, in some cases, sloppy, lab science, and that's part of the problem. There's no quality control. The product of fentanyl, or in other cases methamphetamine, can be produced. But there's no season to that. There's no long supply chains coming from halfway around the world anymore. And that's the reality that we're facing now. I doubt we'll see heroin again because it's too complicated. It's a market that has been supplanted by a much more efficient product, sadly.
So thinking about, the types of drugs that are out there and what they can do, is Emma, I want to go to you, because when we're talking about addiction, we've learned that, there's not a single way to help people who are having substance use issues. And so what are some of the things that are available or some have been found to work for those who use and maybe want help decreasing or fully stopping their use of substances.
Yeah, I am relieved that we're having such a transparent conversation here about how the nature, I think, of using illicit drugs in our communities has changed maybe forever with the prevalence of fentanyl in different drug supplies. The risk is severe, with fentanyl being so prevalent, and it makes an approach known as harm reduction more relevant than ever before. Harm reduction is basically a public health approach that's all about recognizing that there are a variety of biological, psychological, and social reasons why people use drugs, and seeking to assess the reasons why people are using and meet them where they're at and reduce the consequences associated with use. When we went through all of our different definitions of harm reduction, or excuse me, addiction, one thing that was clear to me is that we're now in our society and in our healthcare system at a point where we understand that people can't just stop using. The physical dependence associated with fentanyl use is so severe that we can't just expect people to be able to stop using. So we've got to broaden the scope of what we consider healthcare services for people who use drugs. In my role at Evergreen Health, since 2015, I have been really happy to see our harm reduction programs expand, including here in Jamestown, we opened our syringe exchange program in 2015. Which, with a lot of public support, actually, a lot of folks say, oh, in rural areas, it's going to be really hard in places outside of city centers to operate something as controversial as harm reduction services. But we've been incredibly successful here in Chautauqua County at getting sterile equipment into the hands of people who use drugs so that we can minimize HIV and hepatitis C. But also getting hundreds, thousands every year of doses of Narcan into the hands of people who use drugs and their loved ones. And now we're beginning to transition people from the syringe exchange setting, so active substance users, right into buprenorphine treatment. And so right now, what's kind of different about us here in 2022 versus New York State and Chautauqua County in 2010 or 2015 is that we're starting to really build a whole continuum of services in communities. And I think despite the tragic loss we're seeing, we're actually headed hopefully in a hopeful direction because we are investing in harm reduction services. We're investing in medication-assisted treatment. We're recognizing that we've got to have more ways for people to access treatment. And so I think, if there's any little silver lining to be had from this evening's conversation, it's that fortunately we're headed in a good direction when it comes to having appropriate types of care to meet people's needs.
Mm-hmm. Dr. Cunningham, you have patients that you see as well as you've mentioned, and so when it comes to helping those with substance use issues, what are some of the things or maybe tools that you are able to provide or different things that you've been able to do for folks?
Well, again, to talk more, again, give kudos to Emma and the harm reduction. I mean, if someone is actively using and they come to a harm reduction facility, Evergreen, for a needle exchange, that may be their first encounter or contact with someone who can also offer more help, more services. That might be their first contact with treatment options. Maybe they didn't know what treatment options are available. And again, a non-stigmatized fashion. So I mean that is great. Every patient or every client I talk to, I always talk about other resources in the area like Mental Health Association, Evergreen. What's nice about our community is we are small, we are rural, but I can pick up the phone and talk to any other providers at any other facility anytime. So we all in this community work collaboratively, we all work together because we realize what we're facing here in the community. With that being said, being the director for the Chemical Dependency Program at Chautauqua County Mental Hygiene, which is right across the street here, City Hall, we offer medication therapy, as Emma touched on already, buprenorphine, the catchphrase is Suboxone, right, which can take away, someone's urges, someone's cravings to use opioids. And it's a really amazing medication, and what I really enjoy about this field of work is I can see someone get better. I'm not treating a number like a blood pressure. I'm not treating a cholesterol like a number. I'm not treating a sugar like a number. I'm actually treating a person. The first time they come in, they may be looking kind of rough, having a hard time with things, right? But after we get them feeling better, and we offer other services, counseling. We have all kinds of social services we offer as well. And get them on their feet and get them feeling better. If we can just get them over the withdrawal and the sickness, and then they can start to focus on other things in their life. So it's really it's a great opportunity. But we offer Suboxone again is the main one. We also do the Sublocade shot, which I'm not sure a lot of people are familiar with. It's the injectable form of Suboxone. Wonderful medication, another nice option. We also offer treatment for people with alcohol use disorder, mainly naltrexone or the Vivitrol injection, which we also use for opioid disorder as well. So we have both an opioid option and a non-opioid option, just depending on which way we want to go.
Steve, in terms of what you know of for what's available to help those with substance use issues?
Well, it's really my privilege in my role at the county government overseeing some grants to work with partners across the county, including Evergreen Health, a very strong and crucial partner, the county's outpatient clinics, as well as, I won't name all of them right now for fear I might forget somebody, but really, literally every principal agency that's on the field addressing addiction is, as Dr. Cunningham has said, working shoulder to shoulder, very collaboratively. We meet routinely to strategize, to coordinate our efforts. The result is that for a rural county, and I would want to make this very clear, and I hope that there isn't any misunderstanding about this in the county. For a rural county, we have a whole gamut, spectrum, if you will, of services that can address addiction, beginning with, as Emma has said, harm reduction. Somebody might really not be convinced that they can or even want to, at this point, seek abstinence, but they can still find services and help, for example, from Evergreen Health. For those who want to get into full treatment, maybe do need medication, as Dr. Cunningham has said, we have the county clinic, but there's other clinics as well. There are phone opportunities to literally get started without even leaving home on a virtual a call. We have recovery supports, peers in the county. We now, as of earlier this year, have methadone available in the northern part of the county. So, and there's all kinds of other supports, et cetera, available. So many, in fact, it can almost be a little bit confusing how to navigate. Where do I begin? Where do I go? You told me about all these things, but what can I practically actually do? So I like to continue to repeat what I hope folks that are listening or watching have seen, billboards, et cetera, for combataddictionchq.com. Combataddictionchq.com. And the reason I keep pointing that out, and we want to make that public awareness, is because there is located, among other information, a searchable database, essentially, where folks can say, okay, look, I want to know, where would I go if I wanted harm reduction services? You mentioned a phone virtual service. How would I do that? It's all available to be that information at combataddictionchq.com.
Excellent. Thank you for sharing that resource. I guess maybe, I don't know if I want to call this like a wish list, but is there a method or a tool that's currently not available in the county that you wish you had access to? I mean, Dr. Cunningham?
I think we have a pretty good, offering of different services across all gamuts of what we really need to use here. I know we're going to, again, I keep going back to stigma, but if we could somehow break down the walls of stigma. It seems like the stigma of COVID has brought a lot of mental health issues to the forefront, and mental health discussions, and people need to realize that's a chronic, relapsing medical condition as well. just like use disorders or addiction. It's a chronic medical condition. So if we can break down that barrier and break down that wall, I think that's still the biggest thing that we face every day, and my clients, and I'm sure that everyone else here can attest to, their clients face as well.
Is there anything that you would wish that you had at your disposal in terms of a method or a tool?
I think that just making treatment more available and investing more in treatment, as we've been over the past couple years in New York State and Chautauqua County, is necessary, and we've got to kind of keep our foot on the gas. I think making Narcan even more available almost everywhere. The past week or so, I've been hearing more about Narcan vending machines than ever before. That kind of outside of the box novel approach, I think, to normalizing a disease that is treatable, quite frankly. And then there are some even more innovative interventions that research and evidence is starting to come out about. Although they've existed in other countries for decades, the first 2 overdose prevention centers in the United States just almost exactly 1 year to the day opened in New York City and have reversed with oxygen and very small doses of Narcan, hundreds and hundreds of overdoses. And that's a real kind of harm reduction, real meet people where they're at type of initiative, where in New York City, there are a couple centers where folks can bring in pre-obtained substances and consume them under supervision. And those have been around in other countries for a while, but the first have popped up in the United States. So I think it's going to take a whole comprehensive public health approach, all kinds of different interventions. And like I mentioned, I think and I hope that we're headed in the right direction.
Steve, is there anything that you wish you had at your...
Well, one thing, I sound like a broken record, but I'm glad that Emma mentioned naloxone, or Narcan, as it's often heard. That's available at no cost. People can get their hands on a kit to have available, and if you know somebody who's even on prescribed opioids, and certainly using illicit opioids, that medication is, as she said, saving hundreds of lives in the county. CombatAddictionCHQ.com is where you can find out where to get that. But to your question, as Dr. C said, we have really a tremendous scope of services available in the county, and really committed staff at all of them. I would say there are 2 things that, as most communities are facing, that we're challenged with. One is staffing. Workforce is a very significant challenge, and that's not unique to our county. But if anybody's listening who, a young person that's interested in the field, I assume my colleagues here would confirm, it's a fascinating, there's nothing that you don't touch upon when you touch upon addiction. You touch upon biology, sociology, politics, the human experience. So always encouraging, young people to consider the field, because, and they won't be unemployed either, because the demand is so high. The other thing that is really hard for, again, a lot of communities is sober housing. And we recognize that while treatment options are many, housing and safe, sober housing is something that for many people is a real barrier to their recovery.
Mm-hmm. Yeah, I'm going to say, because you're talking about some difficulties, and my next question was, what are common barriers do people face in seeking treatment? There's a lot of options in Chautauqua County, a variety of options, but we are a rural county, and I imagine that that brings with it some barriers.
Well, the obvious, of course, transportation. We're spread out, and but there are still options. All of the barriers that are very real, and I wouldn't want to minimize them for a second. I just would not want anybody to feel we're insurmountable. If they were to reach out for help, we'll figure something out if they're looking for help. But to be sure, a rural community has the barriers of travel, transportation. And Dr. C has rightly mentioned stigma too. It's probably the internal barriers are almost probably the most challenging.
Yeah, going to Dr. Cunningham, yeah, I was thinking when as soon as I, asked this question, I was like, well, stigma, and you mentioned stigma before. Are there, besides that, or if you want to elaborate on it, what are some of the other common barriers for seeking treatment?
I think the biggest barrier is patients just don't know, or clients just don't know what to expect. I think they've all heard stories from others that they're acquaintances with, family, friends, other programs. I think they've maybe heard some misinformation, some mistruths. If I test positive, they're going to kick me out. It's really all about trying to meet people where they're at in their recovery and sitting down and seeing what they want to get out of a treatment program or out of treatment in general. Are there goals to lower the amount and frequency of their drug use? Are their goals complete abstinence? Some people come in and just want to kind of see what the program is all about. I always encourage my clients, they can bring their families with them, they can bring their friends with them to see exactly that our program is indeed treatment. It isn't just get a prescription and you're good to go. That really, for some people feel it is treatment, and again, that's a conversation we have with people on an individual basis. But we really have to address all the psychosocial aspects of their life and try and help them. I can give them a prescription all I want, but if they have nowhere to sleep that night, if they have no money in their pocket for their next meal, I'm not really helping that person by just giving them a prescription and sending them out the door. So we really have to look at the whole picture and see how we can help them in all aspects of their life.
Yeah. Really, when thinking about it, actually, it's a holistic thing because you're dealing with a whole person. Yes. And everything that comes with that. So, yeah. Yep. Emma, do you have anything to share in terms of what barriers you've seen for people seeking treatment?
Lack of stable housing and communities across New York State, really not just Chautauqua County, but especially, the regions of Western New York are really struggling with having decent, affordable housing for folks. And it's probably the most often barrier that I hear people name in our treatment settings in Buffalo and here in Jamestown and in some of the counties in between. I think it's not really shocking to me that a lot of folks in our communities don't know what to expect out of treatment, because our country, and I mean this as someone who is both social worker during the day, but I also have the opportunity to teach future social workers. I know from the literature that our country hasn't always approached substance use in the type of holistic way that we're able to talk about this evening. The moral model, AKA thinking of people who use drugs or are struggling with mental health like they're a moral failure, was alive and well in our country for decades, if not centuries, and there are still remnants of it. And I think that has an impact. And I think also the punitive model. So this idea that if people use drugs or they're struggling with mental health, then they've got to kind of be locked away or isolated from the rest of society. There are still remnants across all of our systems. So it's really not shocking that some folks don't know what to expect when it comes to getting treatment for substance use disorder. So I think just a kind of, an overarching barrier that I see in folks all the time is that they don't know what the existing treatment looks like, but we also, they're not ready or they don't have resources to commit to the types of traditional treatments that are available. We're really just in the past 7 or so years here in New York State embracing harm reduction, embracing the whole continuum of stigma-free, non-judgmental care. So for a long time, people haven't been able to or not ready to take part in the counseling and occasional medication that was available. When it comes to, I was really moved by hearing you say that it sounds like we're talking about treating the whole person. And it reminds me, I was driving into the parking lot of our Jamestown Syringe Exchange today, and I saw that one of our amazing, extremely committed team members, that really is the magic that makes harm reduction work. You gotta have trust and rapport, and you gotta genuinely love people who use drugs. That's really what makes harm reduction work, and obviously I can talk about that all night, but I'm not going to. But one of our amazing team members had taken a sandwich board that was kind of like advertising something outside the building and drew, just with a single marker, a set of stairs, which for those listening on the radio, my little hand gesture is not going to mean anything for you tonight, but just picture a single marker, a single line, and a set of stairs, and he wrote something along the lines of, change begins with one step. And I just thought, you know, I'm not someone who identifies as someone who's challenged by substance use disorder personally, myself. But I do know times in my life when I've had to make a change or when I've been struggling, I wish somebody had a darn sandwich board that said, one step at a time, Emma, just remember, one step at a time. And that really just kind of thinking about people who use drugs as human beings, that's part of the answer to this whole puzzle, this whole crisis that we're in.
I of course, concur and would encourage anybody who maybe, you know, in all candor, has had a bad experience with treatment for whatever reason. It's kind of a new day, and I would want them to reach out in any event and not let any past experience or the experience of a story that they might have heard from somebody be a barrier for them to reach out. I think they might be very pleasantly surprised to discover that the approach is, as we've heard, very holistic, very much acknowledging that this is a complex issue, and you know, we're all complex, and we can work with that and start where a person's at. If I could, there's one other, you know, rightly acknowledged that when we think about addiction, I think thankfully, increasingly, we think about treating a person in the full scope of what that includes. But even more, I would also want to say, and it's an area that we probably could use even more growth, although there are resources, but I would want to say very clearly that we recognize that addiction does not only affect the person who is chemically dependent, but those who are close to them. And many, many of our, in our case, county residents are, you know, face that, the fear, all the struggles that accompany, you know, a loved one who's chemically addicted. Again, I would encourage them to reach out. Even our own treatment clinics can offer them support, help, and approaches to keep themselves well as be helpful to their loved one. So in this conversation about addiction and those who have a chemical dependency, I want to assure our county residents we're very mindful of the fact that it's also a phenomenon that affects whole families.
That's true, very true. I have a feeling that this question is going to be for Steve, but obviously Emma and Dr. Cunningham are welcome to answer this. But one of the questions I had is that, I've talked to our county executive about this as well, is that there has been funding that has come into the county from various agencies to deal with substance use issues, and you know, and has your agency received any of these funds, and how are you using it? And Emma, maybe you will be able to answer that, but I'll start with, I guess, Steve. Like, what has the county received, and how has that been distributed out?
So I personally, with others, but oversee a couple of those federal grants that, you know, competitive grants that we have applied for and been awarded. And as I described earlier, these partnerships where we gather with other providers, prevention, treatment, recovery, harm reduction providers, the whole scope of services. This funding is helping to fund initiatives, strategic plans that we together develop to fill gaps in the county that we still acknowledge, or to expand some of what we're already doing. One of the things that we're involved in is what's called the Healing Communities Study, one of the largest federal initiatives to address opioid overdose deaths. And our county is one of 16 in New York State. working very closely with Columbia University and the National Institute of Drug Abuse to develop and expand strategies that we are aiming to significantly reduce the numbers of opioid overdose deaths. Just briefly, I can also speak to the fact that we have other funding that, again, federal funding that the sheriff took the initiative in, and we partner with him to leverage, if you will, the criminal justice system as a force for help to move people towards treatment and growth. So there's initiatives underway within the county jail, but also outside of that to address the response to addiction, not only in a criminal justice sort of framework, but to use those, if I could call them, opportunities to, instead of maybe directing somebody into the criminal justice system, to divert them into treatment, et cetera. So we have a lot of these programs happening right here in the county, and a lot of people working really hard on them.
Emma, with Evergreen, has Evergreen seen any influx of grant funding coming in from either through the county or, from opioid settlement monies or from other sources that you've been able to use to combat the issue?
I think we'll see, I hope that organizations like Evergreen Health will see more in the future. The past couple years, there've just been some pieces of enhancements. I think in the past couple years, we've been able to benefit from some SAMHSA dollars to expand medication-assisted treatment. And we actually did that by expanding into Chautauqua County. Previous to the past couple years, we only really did medication-assisted treatment, namely Suboxone and Sublocade, out of Erie County. And right now, really seeing a lot of success here in Chautauqua County with it. Other than that, we tend to have our harm reduction services funded by the New York State Department of Health. And my hope is that with the increasing stewardship funds, opioid settlement funds, just increasing attention on the overdose crisis, that harm reduction is something that is invested in more, and therefore we'd be applying, or looking to partner with folks in expanding harm reduction initiatives, because just very needed as we're talking about today. I just also I applaud the sheriff here in Chautauqua County for really thinking seriously about how to use those funds to provide medication for individuals who end up incarcerated. I wish that it weren't the case that people who are struggling with mental health and struggling with substance use end up in our criminal justice system, but while they're there, right, it's hopeful that areas like Chautauqua County are going to introduce or talk about medication if folks end up incarcerated. And people who know me well know I've never said I applaud a sheriff before, so there's a first time for everything, but that's awesome that
you're on the record.
But he's been talking, the Chautauqua County's been talking about that for years, and so I'm glad that there's funding and a program, yes, and they were able to capitalize on some of the funding coming for substance use treatment in the state.
Mm-hmm. Dr. Cunningham, do you have anything to add to that? That maybe ways you've benefited or seen within your department?
No, we've been working with Steve. We have some small group discussions going on right now on how we can do a better job internally, externally, what other services we may need. But Steve, I'm so glad Steve's here tonight. I think you can do an hour-long talk just with him, and I think you'd also do just an hour-long talk just with Emma. So I'm really happy to be included tonight. But I don't have much more to add to everything we've talked about.
Mm-hmm. I have a couple, questions that maybe we can get to, but from the audience. But Steve touched on this, but Dr. Cunningham, maybe you can also go into it a little bit. We talked about the fact that, addiction affects more than just a person. It affects the people around them too. So for families, for friends, for coworkers who are navigating those relationships with people who are having chemical dependency issues, what are the resources available? We talked a lot about the resources available for a person with the addiction, but what about those outside of them? that are trying to help them or just navigate?
You know, we actually have some specialized counseling services at the county, specialized models that actually are geared towards treating the family members, close contacts, and friends to help them get a better understanding of use disorders, how they can actually help their loved one versus not help their loved one. And it's actually called, one of the models we use is called the CRAFT model, which I see everybody else shaking their head up here. And we actually, you know, families that, because a lot of times you hit the nail on the head, families come in and they just don't know where to turn. They don't know what to do. They feel hopeless. They feel helpless. So it's really nice to have treatment that's also available to them. And it really does make a huge world of difference.
Can you explain what the four of us are familiar, but I don't know that if I'm listening to the program outside here, that I would know what is the CRAFT model?
Yeah, I think I'll let Emma and Steve take that over. Yeah.
Okay, well then I guess we'll go to Emma, and maybe if you can elaborate that, and maybe also explain, you know, what resources maybe even Evergreen has that can help families. Yeah.
Sure. Unfortunately, I know a lot of organizations that practice out of the CRAFT model, and there was a phenomenal trainer who was recently visiting Western New York to try to, you know, scale up the number of organizations that are versed in the CRAFT model. I'm not myself trained. I just know that that is something that people speak very highly of, and one of the reasons why I was nodding when Dr. C was talking was because I've really come to see how addiction can impact the whole family system, and I don't mean that in a judgmental way at all. I just mean that I hope that family members and loved ones acknowledge that it's okay to take care of themselves. And I think counseling can benefit almost anybody, but I would really encourage folks who have a loved one that are really struggling with substance use disorder to reach out and get some help of their own. A lot of facilities that have an OASIS license, so Office of Addiction Supports and Services licenses, are also required to be able to offer counseling or group opportunities to impacted family members. So that's a good thing to know, is that, you know, where there is treatment for substance use, you can likely find treatment for family and friends. Nar-Anon and Al-Anon are still very popular self-help groups in communities. I know Chautauqua County has Nar-Anon and Al-Anon groups. Those are based on the same principles of Alcoholics Anonymous and Narcotics Anonymous, except they are self-help groups for individuals who have loved ones that are struggling with substance use. So those are just a couple things I think we really want folks to know, that help is available, whether you're directly impacted with substance use or you have a loved one. So I think you have to take care of yourself. We often hear this term, you can't pour from an empty cup. You have to make sure that you are replenishing your cup, directing your loved ones to treatment, you know, just normalizing the fact that folks, that we have people experiencing anxiety, depression, and substance use, so we can normalize conversations about getting into treatment. There are a variety of different types of treatment available, regardless of where you're at with your substance use. And so directing loved ones to treatment is important. And we want to see family members exercise boundaries, but not necessarily turning away, especially as the holidays get closer. This is a difficult time. If you have a loved one struggling, that could be a difficult time for you for a number of reasons. And we really just want to encourage folks to lean in and check on your loved ones, as opposed to turning away because of past experiences or because of how difficult it can be.
Thinking about the holidays coming up, in the news business, we say, you know, there's perennial stories, and one of the stories that we always hear is that the holidays are so difficult. And so, yeah, that's good I think that's important to hear, that, you know, we shouldn't turn away from those that who are having difficulties. So maybe third time's a charm. Steve, can you explain CRAFT?
You know, it's embarrassing to say that if I try, it's an acronym, and
yes.
So if I try to name it and I get it wrong, no judgment here, but Community Reinforcement and Family Treatment. Does that sound? It adds up to craft. But, so we'll go with that for now. But as Emma was saying, the general principles of it are to, at the same time, learn ways where a loved one can take care of their own needs and the needs of the rest of their family, while not pushing away their loved one that's struggling with an addiction. So with support and help, learning how to both be well themselves and to interact with their loved one in a manner which actually improves the likelihood that he or she will ultimately seek treatment. Look, nobody comes into life prepared to know how to handle the complexities of addiction. So family members feel understandably absolutely overwhelmed at times, because again, who's prepared for that? And yet at the same time, we know that I could make an argument to say that most people in our county are, and I'm literally, like maybe far more than 50%, are very close to somebody with a chemical dependency. Just statistically, I could make that case. So the point being is that the issue is so prevalent on the one hand, and yet so sort of isolating and overwhelming at the same time. So again, the message we want to give to family members is there are ways that you can look after yourself and the rest of your family while also helping the person that you care about who has an addiction. But, and there's lots of people in that situation. Reach out for help. And again, broken record here, but if you're wondering, well, where? Combat Addiction, chq.com will at least direct you to the clinics that you could find that help in.
And also, I just want to go back through, and Emma and then Dr. Cunningham, if you both can mention, how can people reach your agencies if they're looking for either more information or for assistance? Start with Emma.
evergreenhs.org, our website, would be the best way. We really pride ourselves on being welcoming and non-judgmental. You can walk in to our harm reduction centers in Jamestown or Buffalo or our mobile unit, and you can find the locations for the mobile unit online. This is not the type of service that you need an appointment for. This is the type of place where you're going to be met with a smile. We're going to remember your name every time you come in. We're going to remember how you take your coffee. And so being approachable and non-judgmental is a really big deal for us. And so that's just something to remember about our harm reduction services.
Mm-hmm. And Dr. Cunningham, how can folks access Chautauqua County Mental Hygiene?
Again, they can go to the website that Steve was talking about, Combat Addiction CHQ. Our Jamestown office, Chautauqua County Mental Hygiene, is on the 5th floor of City Hall. Again, right down the street. They can actually just walk in at any time if they would like to talk to somebody, see what services we offer. They can call 661-8330. They can find us on the website. We also have a Facebook page. We also have a secondary location in Dunkirk. That's 6062 Franklin Avenue. Same thing. They can find us on Facebook. They can also walk in that office anytime for an assessment. If they just want to see what services we have to offer, maybe they're thinking about treatment, again, just come in. Somebody will sit down, talk with them, and just kind of see where they're at in their process of recovery and what they want to do.
Mm-hmm. Thank you. And I want to thank all of you for participating in this panel with us tonight. And also thank you to our audience who have tuned in. You will be able to view this presentation again online for free on our YouTube page, our YouTube channel. And we also will be posting it on WRFA-LP.com, and it will re-air on the Community Matters program. On behalf of WRFA, the Regina Center for the Arts team, and Cranky Plate Productions team, thank you for being with us tonight.